Turning now to the coronavirus pandemic in our nation, this week marks 1 year since the first coronavirus case was confirmed in the U.S. And while Georgians continue to wait for the vaccine, our COVID numbers continue to rise. Now, we reached yet another top day for the number of lives lost to the virus just yesterday. At least 170 more people have died, according to the Department of Public Health. That makes more than 11,000 Georgians killed by COVID-19. Now, we're hovering near record levels for the number of coronavirus patients. Right now, that's more than 5,500 people hospitalized. We're also seeing a record number of ventilators in use. Now, the state also reporting more than 4,900 new cases. This was yesterday. Health officials flagged another 2,500 tests as probable cases. Our current 7-day positivity rate is 17.5%. And with the vaccine slow to roll out and urgent questions about its effectiveness against new strains, scientists say it's a race against time to get this situation under control. Liza Lucas joins us now. And Liza, the state says half of the COVID-19 vaccines are still waiting to even be administered.
That is indeed the case. In fact, Georgia's top health official, Dr. Kathleen Toomey, she also acknowledged that the appearance of unused vaccines just sitting around does not look good. But she says this really isn't a case of vaccines sitting unused in freezers with no plan. In fact, according to the governor's office, over the course of the last week, the state administered more than 216,000 vaccines, and that is more than double the previous number. Now, this after the state was criticized for falling near the bottom of the 50 states in vaccination rates. Now, to date, the state has administered 48% of its allocation, and you can see those numbers up on your screen. Dr. Toomey confirmed to lawmakers Tuesday that the remaining doses, they are already allocated.
So most of those doses are actually already allocated, and there's a plan for them. And so it looks like we've only used half, but that other half isn't sitting somewhere. It's sitting because it's going to be used in the next days ahead.
Dr. Toomey also said some of the supply is currently at Walgreens and CVS stores waiting for vaccinations to be finished at long-term care facilities. Now, throughout this meeting yesterday, she also acknowledged the difficulties some people have had in scheduling their second appointment, and she says that the logistics, they are still very much a work in progress.
Liza, thank you. And to help with vaccine scheduling issues, Emory Healthcare now has a waitlist system in place. Patients who meet the Phase 1A criteria can request an appointment on Emory's website, and you'll be notified by text or phone when a time slot becomes available. After you get your first dose, you'll be able to schedule your second one, which could take weeks depending on supply.